Teresa, Life Beyond Diabetes. And I apologize, I'm coming to you a few minutes late because honestly, I've got a friend visiting from out of town and we were having so much fun. I got carried away and completely missed time to go live. So here I am, about 45 minutes late. I'm super excited excited to be here to talk to you about the new dietary guidelines that the ADA announced earlier this year. Before I talk about the new guidelines that they announced, I'm going to talk about the old guidelines that were in place. It used to be, up until earlier this year, the ADA guidelines were very much one size fits all, and that was, they were recommending 45 to 60 grams of carbohydrates per meal. So that is, so a standard serving of carbohydrates is like, I think, half a cup of rice, and that's 15 carbohydrates, and that may even be 30 carbohydrates. Anyway, that's a lot of carbohydrates, and to kind of put that into standard, in my low carbohydrate lifestyle, I try to eat less than 100, generally closer to 50 to 75 carbs a day. So 45 to 70 grams of carbs per meal is more than I eat in a day. So that's a lot of carbs for me. And so that's per meal. In addition to that amount of carbs per meal, they were recommending snacks be 15 grams of carbs. Now, for a lot of people, they were having difficulty keeping their blood sugar under control, eating that many carbs. And so the American Diabetes Association, with that high of carb intake, was then saying, well, what we need to do is we need to eat that many carbs, but cover those carbs with additional insulin to keep your blood sugar down. So the change that they've made this year is to take a completely different approach and say, you know what we've realized? There is no one size fits all recommendation for what a diabetes diet should look like. So it may be true that eating 45 to 60 grams of carbs per meal is appropriate for some people with diabetes. And honestly, I don't know that. It might be that that is an appropriate way for some people with diabetes to eat. In my opinion, that is not an appropriate way for most people with type 2 diabetes to eat, because they have insulin resistance and they struggle with processing carbohydrates. But they have, so in the new guidelines, they are recommending either a DASH diet, which DASH diet is a low-fat, higher carbohydrate diet, closer in carbohydrates to the original ADA dietary recommendation. That diet was developed for heart disease and high blood pressure. They also say, hey, if low carb is your way to go, great, that is what you need to do. They also are endorsing now a vegetarian or a vegan diet, or a Mediterranean diet, which is, again, moderate protein, moderate carbohydrates, and moderate healthy fats. So what these guidelines are saying, and one of the things that I teach, is it's very individualized, and each person needs to look at what they're willing to do, what is a diet that is sustainable for them. And now I believe that that doesn't mean, hey, what's sustainable for me is going to McDonald's every day and eating French fries and fast food. It doesn't also mean, you know, you don't need to make some changes if you're not eating in a healthy manner, or the manner that's best for your health. But our bodies are all different. And, you know, for most people with type 2 diabetes and prediabetes, we need to be on some kind of a lower carbohydrate diet than the standard American diet. But the American Diabetes Guidelines now are giving some broader perspective of that and allowing us to make those changes. And as providers, it's nice to know that as a medical provider, the advice I'm giving my patients is within the guidelines now. And I'm excited to be able to pass that on. So that's it for today. Tomorrow, I'm going to be back here. Hopefully, I will be back on time. And I'm going to be talking about bariatric surgery and using bariatric surgery as a tool in the toolbox for treating type 2 diabetes. We'll see you then. Bye.